Melanoma is the fifth leading cause of cancer in the United States. We diagnose about 100,000 new cases a year, and it's important to know that this is a very serious skin cancer. Nearly about 1 out of 10 patients will die from melanoma every year. It's the fastest growing cancer, especially amongst the young people, and it's important to know that it is the leading cause of cancer death amongst young people. So it's a cancer of younger population. There are many risk factors for melanoma. One of the common risk factor people talk about is familial, where it can really run in the family and people will be predisposed to it. It also, people who have different moles on the body, too many moles, they're also at risk for melanoma. And people who have atypical looking moles on the body, what we call in medicine nevus, those are also increasing the risk of melanoma. But the most important is what we can avoid. We cannot really control how many moles we have on our skin, but what we can avoid is exposure to ultraviolet radiation, which is typically seen in intense exposure to sunshine when we get those sunburns on the skin. Those episodes, and also when people start going to tanning beds, can increase the damage to the skin from ultraviolet radiation, and that is the reason that the incidence of melanoma is increasing, because more and more it has become fashionable to go out and to be out in the sun, and that leads to damage to the skin, which can increase the risk of melanoma. And that's why melanoma is most often seen on sun-exposed areas of the body. Forearms, face are the most common site, and also on our backs and chest, because once we are out there on the beach or out there laying in the sun, most of us will not be wearing a shirt or will be having minimal clothing to protect our skin. It has been seen that the incidence increases when you have these intermittent exposures. So typically during the childhood is when the risk is higher, and when a child may get a sunburn one day and then will be probably not going out for another week or 2 weeks, as compared to farmers who have this constant, almost daily exposure to sunlight, and their incidence is not as high as when it is at a younger age and it's intermittent exposure. So that is another thing to keep in mind. You cannot compare an exposure of a child to intense sunburn with that of a farmer who probably does it every day. Most of the melanomas are in the superficial layer of the skin we call epidermis. Most are curable with surgery, which is to remove it. But even before that, if there is an atypical mole on the skin, it's important for a person to bring it to the attention of their primary care doctor or their dermatologist. It has been seen that a dermatologist will have a 70% accuracy in detecting a melanoma. When they surveyed many dermatologists, they found that about 70% of the time they can pick up a melanoma by just examination. But there are some other techniques like dermoscopy, in which they can see how deep it is, the mole, and the color changes, and the accuracy can increase to 90% with those techniques. So in the hands of a professional, just by examination, there's a 90% chance they can tell whether it is a melanoma or not. So before somebody needs to do biopsy, they might be able to tell, yes, it really needs to come out. And obviously biopsy is where you take a small piece of that area and remove it and look under the microscope to confirm the cancer. So most melanomas on the skin we call cutaneous melanomas, and there can be melanoma inside the body, like I have had patients who had melanoma inside the lung or inside their GI tract, in the rectum. So there could be melanomas inside the body, and obviously there is no solar exposure to that, which means there could be other factors which can increase the risk of melanoma. Whenever somebody has a mole or atypical mole, or it has changed the color or something, a trained clinician will examine it, and what we teach the patient or people is to follow 5 factors. We call that A, B, C, D, E with different acronyms, and it is easy to remember and apply that. A stands for asymmetry, which means the mole is different parts of the mole are not exactly the same round, or it is asymmetrical with different parts. And B stands for border irregularity. That means the border of the moles are not straight line but irregular borders. These are all risk factors for that mole to be a melanoma. C stands for color variation, and that means some part of the mole may be darker, some are lighter. That again is a little bit of a red flag. D stands for diameter, which is more than 6 millimeter, which is about 1/4 of an inch. If it is bigger than 6 millimeter, then that also would be a red flag. And E is for evolution, which means that it is changing itself over time. So if you notice this 6 months ago or a year ago, or your spouse or somebody else in the family noted a mole and it is changing or it's evolving into something, then that would be a red flag. So this is what we call A, B, C, D, E. So people can keep track of it, or family members can keep track of a mole, which if it is in a location where a person cannot see the mole himself or herself, then a family member can keep track of it and mark your A, B, C, D, E, and make sure that it is not changing, color is not changing, borders are not irregular, and it's not asymmetrical. If any of these factors are present, then we do recommend seeing a dermatologist or at least your primary care physician to have it checked out. As far as preventing melanoma is concerned, using sunscreen is very important, but also minimizing sunburns. So we think another way is to not expose your skin too much to a sunburn, especially at a younger age. So we can do this to reduce the chance of melanoma. Interestingly, the incidence of melanoma is highest in Australia, and that is because there is possibly a hole in the ozone layer in the atmosphere above Australia, and that increases the ultraviolet radiation and increased risk of melanoma in that part of the world. So Australia really has relatively the highest incidence of melanoma amongst the countries which are predominantly have the white non-Hispanic population, which is another important factor because melanoma is seen more commonly people who are fair skinned or white skin compared to people who have darker skin or African Americans in this country. But having said that, melanoma can still occur in people with darker skin, especially in other parts of the body like the sole of the feet, what we call acral melanomas. So just because you are African American or you have brown skin does not make you immune from developing melanoma. The other important thing what we can do to reduce the risk of melanoma is very important, is to reduce or avoid going to tanning beds. Studies have shown that people who use tanning beds, and that is typically more common amongst the female population, is to use a tanning bed before age 25 can increase the risk of melanoma by about 34%. And people who have used tanning beds on more than one occasion also significantly increase their risk of melanoma compared to people who have never used it. So avoiding tanning beds is also very important to reduce the risk of melanoma. We're going to talk about patients who have developed melanoma. It is a very serious problem for some patients where this cancer can spread to other organs such as brain, lung, liver, and other parts of the body. When that happens, this is considered a very serious disease. Luckily, there have been recent advances in treating advanced melanoma, or what we call stage 4 melanoma. The new kind of drugs we call immunotherapy drugs. These drugs boost or unleash the patient's immune system to attack the cancer cells, and we have had significant success in treating these patients who have advanced disease. The melanoma can even spread to the brain and other organs, and these drugs will still show some efficacy. Traditionally, melanoma did not respond very well to chemotherapy, so chemotherapy has never been used very much in treating this type of cancer. Certain mutations on melanoma, we call like BRAF mutation, can also make this cancer susceptible to oral drugs. But again, these are only used when the melanoma cells have that mutation called BRAF mutation. It is not effective in all melanomas. But immunotherapy treatment have really changed the outcome for most patients, and remissions can last very long. If the cancer can be removed by surgery, then that is preferred treatment if possible. Unfortunately, melanoma can come back even many years after it has been removed or treated, even 15 or 20 years down the road. So we advise patients to continue follow-up with their medical oncologist and a dermatologist or surgeon, whoever can keep track of it and make sure that there's no recurrence, because early detection can lead to early treatment, which is beneficial in reducing the risk of death from the cancer.